No surprise, the best way to ward off a cardiac event is with prevention and education. Two important tools used by Dr. Nitza Alvarez at Tri-County Heart Institute in her effort to keep her patients or potential patients healthy and help them prevent the stent.
One of the things that I try to make my practice be different is in prevention. I wanted my practice to focus on preventing cardiovascular disease, identifying cardiovascular disease before you suffer a heart attack. How do you know that you have cardiovascular disease? When it comes to women and heart disease, we know that women are very different compared to our male counterparts. It wasn't until 2016 that the American Heart Association released the first statement recognizing, after 93 years of the history of the association, that heart disease is under-recognized in women, presenting in a way positive the need for more studies to understand why are we different and the differences in treatment and why are we treated differently. We know that women tend to develop cardiovascular disease later in life. Past the age of 55 is when our risk is equal to a man risk. Men tend to develop cardiovascular disease younger in life. We look for men age of 45 at increased risk for cardiovascular disease. Nutrition plays a significant role in cardiovascular health. When we're talking about cardiac diet, for example, the American Heart Association recommends the DASH diet, which is a diet to target blood pressure to help reduce blood pressure or prevent hypertension. Essentially what it is a diet that is rich in fruits and vegetables, grain, and lean meats, mostly emphasizing poultry, fish, less red meat. As a provider, I think sometimes it's a little bit discouraging when you are talking to your patients and encouraging and explain to them the importance of lifestyle modification and physical activity as part of it. Exercise is actually one of the other risk factors we emphasize in our patients or our population for prevention of cardiovascular disease. Exercise not only reduces your chance of having a heart attack, but also reduces your chance of developing arterial disease, stroke, diabetes. We can name every single organ in your body. Exercise will help with dementia. Exercise will help with depression. Exercise will help with constipation. Exercise will help preventing colon cancer. Exercise will help preventing osteoporosis. People that exercise tend to have lower blood pressure, lower cholesterol levels, which are risk factor for cardiovascular disease. When people exercise, they have a less tendency of developing diabetes because they will tend to be less obese. But let's say the patient already had diabetes. Exercise will help them control the diabetes better. It makes the tissue be more receptive to the insulin, so that way their sugar levels will be much lower in their body. The education is important. We know that there are some ethnicities that are higher risk of developing cardiovascular problems. African American, especially because they tend to have higher blood pressure. Hispanic, because they tend to live more sedentary life and they tend to have more diabetes. What are we doing to let them know that, to make them aware of it? I always say to my patients, you gotta be your own advocate. And whenever I go out and, try to educate people, I said, if you feel that you haven't been heard and your symptoms are still there, you need to look for another provider. Don't let that be the end of the answer.
If you're looking for more ways to a healthier heart, you can join Dr. Alvarez every second Saturday of the month for Walk with a Doc. Participants will enjoy a brief presentation on an important health topic, followed by a walk at your own pace led by Dr. Alvarez. And we'll have highlights from her 2 Heels versus Ties February appearances and book signings in our March episode. You'll find information on Walk with a Doc, Heels versus Ties, and the Tri-County Heart Institute when you click the Prevent the Stent story link icon online at yourhometownhealth.com.